Welcome everybody. It's good at least see your names virtually and to be here with my colleagues. As Melissa mentioned in the chat, you can submit comments and engage with us via the Q&A box. And we will have plenty of time at the end, hopefully, to go through some Q&A and make sure we have that all settled. And I'm going to get us started. So my name is Chantel Meek. I'm the founding executive director of the Children's Equity Project at Arizona State University. For those of you who may not be familiar with us, we are a child policy center that focuses on an array of policy issues that impact young kids and families from the early years and throughout the childhood continuum. We focus all of our work on really closing opportunity gaps and building equitable child serving systems across research, across policy, across practice. And we work at all levels, a lot of local work, a lot of state work, and a big chunk of our work is national work in federal policy. Let's go to the next slide. So today we're excited to talk about and share a little bit more about our new report that was just recently published that really looks at how we can use state CCDF plans as levers to expand access, to enhance quality, and to advance equity. At the CEP, we probably sound like a broken record because everything we do is kind of within the early care and education system is really looking at those three dimensions. How do we make it more accessible for folks and equitably accessible? How do we enhance quality, right? And really level that playing field and increase it and advance equity and pay particular attention to our kids and families from historically and contemporarily marginalized communities. And so we know that the CCDF plans are just one lever, and we need to be using all of the levers because of the current state of the system. So today we're going to dig in to talk about that report and to kind of provide an overview of 9 or so recommendations that we provide in ways that we can really incorporate equity and these other pieces into state CCDF plans. Go to the next slide. So I'm joined today by 2 of my wonderful colleagues, Dr. Eric Boucher, who is a research assistant professor for early childhood policy at the CEP, and my other colleague who needs no introduction, the fabulous and amazing Dr. Rosemarie Allen, who is a professor at MSU Denver and at the Children's Equity Project at ASU, and of course is the founder and CEO of the Institute for Racial Equity and Excellence. So if we go to the next slide, my colleague, Dr. Boucher, and I will provide a little bit of an overview of the report and then save a chunk of the time at the end to be in dialogue with Dr. Allen, who is a former state child care administrator and of course is one of the nation's leaders on all issues of racial equity and in particular early childhood and thinking about racial equity with our youngest children and families. You can check out the report using the QR code here. And why don't we jump to the next slide. All right, so as I mentioned, we're going to be providing 9 overarching recommendations for lead agencies to think about as they leverage the CCDF plan this round and plan to address dimensions of access, quality, and equity to better reach eligible kids and families. All of the work at the CEP really has an emphasis, again, on, I mentioned, historically and contemporarily marginalized communities. That includes Black, Indigenous, Latine, and other children of color. That includes kids with disabilities. That includes kids who are emergent bilingual, and children from under-resourced communities and low-income households as well. And of course, kids who hold all of those identities and many of those identities at the same time. Next slide. All right, so I'm going to pass it to my colleague, Dr. Boucher.
Thank you. We're excited that you are joining us for this session, and we're really optimistic and excited to share this report, not just to help lead agencies, CCDF lead agencies, make decisions in their state 2025-2027 plans. It's also meant for early childhood educators, child champions, people who are community members who really care deeply about ensuring that children have equitable access to quality early care and education across communities. We see this as an important resource to help guide conversations both for CCDF state lead agencies and also those who are working with and on behalf of young children. So I want to share a little bit of context about what the sort of backdrop is and why this report is really opportune for states and territories at this time. First and foremost, about the CCDF. It is our nation's largest primary federal child care program, providing funds to every single state and territory. And we see it as a key lever to ensuring children and families have equitable access to quality early care and education, which is a part of the CCDF rule and law. It also requires states and territories to submit a plan every 3 years that describes activities, strategies, goals to effectively implement the CCDF across communities. Next slide. So that was recently finalized. There was a 2024 final rule. We want to highlight a couple of specific important components that you'll see as a thread throughout the recommendations that we provide. The new CCDF final rule limits the amount of co-payments that families can pay to no more than 7% of their family household income. It allows flexibility for waiving co-payments for specific populations. Some of the populations we've mentioned that are important to consider as we think about historically and contemporary marginalized communities: children with disabilities, children experiencing homelessness, children in the foster or kinship system, and those who are enrolled in Head Start and Early Head Start. And there's a couple other pieces that are specific to how lead agencies engage with the early childhood providers who provide direct services for children and families, specifically requirements in the new rule around on-time payments, making sure that the cost of providing care, quality care, is fully covered, and paying on enrollment rather than attendance of children in programs. There's also a new requirement for a use of grants and contracts options, specifically to ensure those direct services for young learners, and also the encouragement of prospective payments, paying early childhood programs before children receive their services. And there's some new information about clarity around flexibility in presumptive eligibility. Now, at the same time as the federal rule, after the federal rule was finalized, the CCDF plan was also being revised to better align with the new policies in the final rule. It was expanded from 8 specific sections that states and territories responded to 10 sections. And there were a couple places where more checkboxes or charts were added to be a place where states and territories could describe their specific activities related to childcare. Next slide, please. So with the backdrop of a new CCDF final rule and a revised CCDF state plan for 2025 through 2027, we see that this is an opportune time for CCDF lead agencies, for states, for early childhood educators, and those who are working and are committed to advancing equity for young children. This is the perfect opportunity and lever to operationalize accessible quality care for children, for families, and for the early childhood workforce, who does the essential work of supporting young learners in our community. And specifically focusing on how can we think about improving access, enhancing quality, and advancing equity for those marginalized populations that we touched on. Next slide, please. And can we go one more slide? Thanks, Melissa. So across this report, we provide 9 concrete overarching recommendations for lead agencies and for childcare champions who are involved in the public comment process, who want to be a part of the planning process. This is to help guide the conversations. I want to note a few things before we share the full 9 recommendations here. One is that they are aligned and consistent with the Children's Equity Project's Start with Equity from the Early Years to the Early Grades report. You can find that on cep.asu.edu, and it's an expansive report that looks at specific facets around access and quality for many of the populations we'll be talking about today. It's also aligned with some of our state work that we've been engaged with over the past few years. Most recently, a Start with Equity California report and a Start with Equity Arizona report, both of which honed in on the overarching recommendations that we had for the Start with Equity from the Early Years to the Early Grades report, and really looked at what state early childhood systems look like, what are the enablers and what are the challenges related to equitable access, and specific ways in which regulation, policy, and practice could be improved to better support children and families. So check those out on our CEP website, cep.asu.edu. So we're going to spend some time going through a brief overview of each of the 9 recommendations that we make in this report. We look at improving parent affordability and access to quality care. We think about how the CCDF state plan can help stabilize the childcare system through grants and contracts. We think about quality improvement activities, boosting health and safety, specifically looking at the changing climate and making sure that children have access to safe, quality environments that include lead-free water systems, looking at improving the access and quality of inclusive childcare for children with disabilities. As a person who was a child with a disability when I was a young learner, there's such a power in ensuring that we're realizing the rights of young children with disabilities to access quality care, not just because they deserve it, because they're young children and that's what they deserve. It's also, research shows lifelong implications for children with disabilities accessing inclusive childcare. So that one's particularly important to my heart in the work that I do. We also focus on expanding access and quality for emergent bilinguals or dual language learners, emotional well-being, specifically through prevention of suspension and expulsion. We think about data systems and how states and territories can better publicly report data to help parents make decisions about quality childcare. And finally, we'll talk through how you can so after looking at how you can use the plan to engage in these levers for advancing equity, we also have another resource that can help in the ongoing process of ensuring that states are looking at their landscape, identifying strengths, and prioritizing areas for specific investment and collaboration. Next slide, please. And I'd like to share just a little bit about how the structure of the report looks. One of the things that we felt was most important was we want states, territories, communities, and educators to use this resource as a tool to engage in the conversations, especially now as states are finalizing their plans to submit before July 1st when they're due, but also in the ongoing conversations between 2015 and 2027, or 2025 and 2027, especially as states can make amendments to their plans anytime throughout that time period. So this is really intended to be a driving force to help in those conversations. So as you go through the report, you'll notice there is a section on background and research that really elevates and highlights the need for that specific recommendation. And then each section has a blue box just like this that you see on the screen. This blue box includes an overarching recommendation at the top, a specific lever that a state or territory can include in their plan to improve access, enhance quality, and advance equity. We also listed very specifically in the CCDF plan template where that specific lever could be addressed. And importantly, as we're thinking about where exactly we can make these concrete pieces operationalized, we included page numbers for the CCDF plan template to help really hone in the specific areas where these levers could be adjusted and effective. Next slide. So our first recommendation, let's go one more slide as well. We want to spend just a little time doing some brief overview around what the specific recommendations are for the 9 facets that we looked at. Most importantly, our first set of recommendations is around parent affordability and access to quality care. Our first recommendation is to allow presumptive family eligibility using public benefit as a determiner without additional documentation, which is in line with the recent notice of proposed rulemaking for changes to the Head Start standard, which was really focused on, or is focused on, boosting compensation, benefits, and support for the workforce, and improving access for families like presumptive eligibility using public benefit. Next slide. In that context, too, we also know that the cost of care is often subsidized by the low wages that the early childhood and education workforce receives. And as a result of those low wages, most early childhood educators qualify, more than half across the nation qualify for public benefits, and most of them are likely income eligible under the federal rules for childcare. So our second recommendation in this section is to waive co-payments for eligible childcare workers, Head Start employees, and other early childhood providers who provide that direct service to young children. And that can be addressed specifically on pages 34 and 35, which speak to the other criteria that the states and territories establish as priority populations to waive co-payments. Next slide. Recommendation 2 is around the childcare system stabilization and thinking about how grants and contracts could serve as an important mechanism to provide a consistent, reliable funding source to early learning programs and ensure stability across the system. From research, we also know that grants and contracts provide a higher, it's more predictive of incentivizing new providers to become contracted with CCDF serving agencies. So our recommendation here is to establish direct grants and contracts to providers who serve specifically in the priority populations that are listed in the CCDF. Those are communities with low supply of quality childcare options, infant and toddler slots, and underinvested communities. And then we've added a consideration that's not listed specifically in the rule, but could be a priority population under CCDF, and that's communities that have been historically marginalized, specifically thinking about children who are dual language learners and emerging bilinguals, which we'll talk about in just a little bit. And you can find additional information on page 46. That's where you can implement that in your CCDF state plan. Next slide. Our other recommendations under the grants and contract system are to establish formulas within those grants and contracts that are aligned with the cost of quality. And those formulas should consider fair wages, benefits, ongoing coaching and professional development, better ratios and group sizes to ensure that there's positive interactions between early care and education providers and children, and key health provisions that we'll talk about in recommendation 4, which is boosting health and safety. And then thirdly, ensuring that the policies and the grants and contracts, states and territories can make the decision to align those with the Head Start program performance standards, specifically as we think about those as really a guiding star for quality services across the nation. Head Start programs reach children in every zip code across the nation, and they share a standardized, consistent set of expectations for capacity building, comprehensive services, and fair compensation for early care and education providers. So that can be addressed specifically on page 95 of the plan. Chantel, over to you.
Great, let's go to the next slide. All right, so quality improvement activities, and I should say we are in the process of developing a new report all about quality broadly to go with the other reports that we've written about on quality. Equity is quality and quality is equity. But in the context of the state plan, we know that so often that the CCDBG quality list is long. And it's kind of all encompassing, right? And so often quality funds are dispersed really widely across lots of things, which means that there's not a lot of meaningful progress or deep investment in particular areas, including in areas that we know disproportionately impact kids from historically marginalized groups. And so really a lot of our quality recommendations here are thinking about where a lot of states are investing a lot of their quality monies and thinking about how we can engage in a little bit more equitable distribution of resources and targeted focus on quality. So really thinking about tiered reimbursement systems. We know a lot of states are spending a lot of quality dollars on tiered reimbursement rates. We also know that there's some preliminary research that finds that these tiered reimbursement rates could result in like a cycle of inequity, right? With providers who already have more resources being able to achieve those levels and get more reimbursement, whereas providers who don't, locked out of those higher rates and unable to continue to meet higher levels of quality. We know that there's research out of Pennsylvania, for example, that has found that providers who serve primarily Black children in particular have been locked out of these higher reimbursement rates in the tiered system there. And there's research in other places to suggest that as well. And so really taking a critical look at our tiered reimbursement systems, if we are investing a large amount of quality dollars on these pieces, really thinking about equitable entry into the system, really thinking about quality growth and where we prioritize our funds with respect to those. And then of course, we have a whole report on QRIS, but a lot of states still investing in quality rating systems, and a big challenge with that is that equity content is often left out of these quality rating systems. And so yes, you get higher reimbursement if you're rated higher quality, but you could be rated high quality and be expelling a bunch of kids or excluding kids with disabilities or engaging in all English instruction, and still be rated high quality and get those higher reimbursement rates if equity is not embedded into the content of what we are being rated as. So really thinking about those tiered rating systems and QRIS in general. Next slide. The other pieces are really thinking about data and the data that's collected to better understand at a disaggregated level, a very disaggregated level, children's access to care, children's experiences in care, and children's outcomes resulting from care that really look at a broad range of social identities and their intersections. That is one challenge of a lot of the existing data, that we can't look at the intersections of many of these identities to better understand what access, experiences, and outcomes look like for kids. Really thinking about the childcare stabilization grant program, and in lots of states that was really the big first like established set grant making program directly to providers, and getting money out the door. And we know all of the important benefits that brought during the pandemic continued throughout. And so really thinking about how we can take the infrastructure that was built during that period and through the childcare stabilization grant program and expanding that beyond to kind of bridge toward grants and contracts, as Eric mentioned a bit ago. Next slide. We have also written a lot about the early Head Start childcare partnerships and how they should really be a lever for equity, a lever for quality, and how they are one really concrete pathway to start to bridge the very, separate and often unequal and often different playing fields between different parts of the ECE system. And so really thinking about how, yes, we have this federal grant program. It's a small little federal grant program with EHS ECPs, but states can establish and grow their own early Head Start childcare partnerships and use that as a really clear mechanism for increasing quality and aligning the system, making it easier for kids and families, and expanding access to high quality care across the board. Next slide. Let's go to the next one. There we go. Oh, sorry. There we go. The next one really array kind of CCDF quality activities and really ideas for how to embed and think about equity within those different pieces, right? How do we think about it within our PD and training systems? What is required training versus optional training, right? What is expected versus, oh, you can do it if you want? And how do we think about those pieces? How do we think about state early learning guidelines, right? And Eric mentioned the Head Start model before, but really thinking about, again, greater alignment. We don't have to be so disjointed, right? As a field, we have some kind of materials and resources and starting places that we can begin to align to, like the Head Start Early Learning Outcomes Framework, for example. Really, again, thinking about tiered reimbursement systems because so much quality dollar is going into them. Really thinking about how childcare resource and referral services, we know a chunk of quality dollars goes in there, but really embedding the voices of parents and families, which are often not at the table enough or at all in lots of states within the CCDF plan development process and otherwise. Really thinking about quality and how we are defining quality, as I mentioned earlier, right? If we're defining quality in a way that totally ignores these really important experiences that kids, disproportionately kids from historically marginalized community, Black children, children with disabilities, kids who speak languages other than or in addition to English, are experiencing, then we are ignoring and we are not investing in their experiences, right? And ensuring that they are having positive and enriching and nurturing experiences that they deserve. And then really thinking about, of course, the workforce, as we've already mentioned. Next slide. All right, the next one is really thinking about health and safety. And really thinking about kind of honing in. We've done work, and we do have an upcoming report on state childcare licensing policies, but really thinking about how licensing and CCDF plans and CCDF systems are really working together in lots of states. You know, they're in separate agencies and separate places, and there is not a whole lot of collaboration. In other places, it's kind of one and the same under the same place. But regardless of what the governance looks like, in too many instances, right, we have licensing that is subpar, that is placing overemphasis on things that don't really impact child health and safety, and then completely neglecting things that really do impact children's health and safety. One of the pieces that we have been thinking so much about is lead in water, and ensuring clean drinking water, and ensuring that we are not putting lead, that drinking water that has lead in babies' bottles in childcare settings, right? But we do not systematically look at that across the country. That is not systematically or automatically included in state licensing systems, right? We don't have a systematic check, and so we don't know. But every time we do look, so for example, California recently passed legislation to test the drinking water in childcare and early learning programs, right? A huge proportion of samples come back with lead in the drinking water. And so really thinking about how we can start thinking about testing and ensuring clean drinking water as like a base health and safety requirement, whether or not it's in licensing. How can we use CCDF dollars if it's not in licensing to ensure that that is the case? Next slide. Really thinking about the changing climate, right? There was a report published last year, I believe, on climate change in early childhood and how we should be thinking about mitigation, protection for kids, resiliency around changing climates and changing environments, and how we need to be thinking about that in childcare, right? I live in Phoenix, where it is very hot, and in certain times of the year, it is not safe to go outside. Last summer, we had all of the poor quality air, right, in the Midwest and in the East Coast, right? There's all these pieces that work into that. We have flooding right now in Miami and in different parts of Florida. But thinking about, had these things begin to happen, right, and in more intense ways, in more frequent ways, how are we using our plans to plan for the future and ensure our facilities and our workforce and our systems have those mitigation strategies in place to protect kids and really prioritize health and safety of the kids and the workforce who are in these settings. Next slide. Really thinking about the workforce, of course, and professional development, and how we're embedding these, equity and the various pieces that we've already talked about within professional development systems. Next slide. Right, the next slide is really thinking about number 5, kids with disabilities in childcare systems. We know that kids with disabilities, people with disabilities, have the right to be included in every aspect of society. Childcare is not exempt from that, right? And so yet we know that so many, about a third or more than a third of preschoolers with disabilities receive their services in environments separate from their peers. We know that research has found that parents of kids with disabilities report a much harder time finding care, childcare, and we know through CCDF data that about 40%, almost half of the states, reported less than 1% of their CCDF subsidies going for to children with disabilities. That's completely unacceptable, right? Like, is it both that this is really happening and kids really don't have access, right? We've also heard on the provider side, right, lack of preparedness, lack of resources, lack of support to serve children in inclusive settings. And so the system really has been failing children with disabilities across the board. When you think about licensing, when you think about quality spending, when you think about what's included in quality rating systems, kids with disabilities are really not represented and not front and center in these systems, and we're seeing that across the board. Let's go to the next slide, please. One more. Yeah. So we provide a number of recommendations on that end, really thinking about the data we're collecting so we really truly understand at a local level, and of course at the state level, how these children are being served, if they're being served, why they're not being served, what their experiences are in care, if they're being served in inclusive childcare or not, right? Really thinking about our quality frameworks, and if they explicitly and intentionally include kids with disabilities, include inclusion of kids with disabilities, support for the workforce to serve kids with disabilities, if our licensing systems are really carefully examined to ensure that they are not, whether intentional or not, excluding kids with disabilities through things like toileting policies that are very common in programs and even state licensing across the country. So really thinking about all of these pieces and how we need to shore up everything from licensing to quality spending to quality frameworks to workforce to subsidy receipt for kids with disabilities. Next slide, please. Really thinking about, again, the partnerships with IDEA serving systems, state education agencies, often once you get to the preschool years, and thinking about how those partnerships are happening, right? How community-based settings should be seen as viable and totally acceptable places to receive preschool special education services for preschoolers with disabilities. Next slide. We also know that there are lots of disparities in the Part C system, the infant toddler program for services for infants and toddlers with disabilities, with racial disparities, language-based disparities, when we think about every dimension of the system, right? Like at what age children are first screened and identified, how long it takes from their identification to getting into the system, how long they get to stay in the system and how many months of services they have, what the dosages of actual services, all of these different pieces. And we see differences across groups in lots of these different places, and childcare plays a big role in ensuring that kids have inclusive settings to go where early intervention can also be provided, right? Often it's in the home, which is good and really important, but also those same kids go to childcare, right? And if there's not that connect between what's happening in the home and the early intervention plans, then there's that disconnect with childcare and lost opportunities there for really supporting that child. Next slide. All right, and last, I think this is the last one I'm going to talk about, is really thinking about access and quality for kids who are emergent bilinguals or dual language learners. We know that this is a large and growing population in the United States. In states like Arizona, where I live, it's nearly half of children under 5 are dual language learners. In states like California, it's more than half. Most of the children in that state, right, are speaking a diverse array of languages at home. Despite what we know about the benefits of keeping the home language, growing the home language, in so many places across the country, care, whether that's childcare for babies or preschool, or education for the older school-age kids, we know that so much of it is provided in English and exclusively in English. This is not exclusively the case, of course, and it is more the case once we get to center-based settings compared to family childcare settings, for example. But the fact that there is this huge mismatch between what we know is a high quality experience for this really giant population in the United States, and that is totally in conflict with what is happening, and is a really big challenge as well. And so really thinking about how we are, again, when we think about quality frameworks, when we're writing in our state plans, right? The subsidy pieces, when we're matching up, right? And ensuring children who are emergent bilinguals know where those dual language opportunities are in their community. What is the role of the state in that intentional pairing, right? Really thinking that through. If we go to the next slide. In so many states, we don't even have data on kids who are emergent bilinguals, right? What with and without disabilities, what languages they speak, right? We don't have data on where those dual language programs are or where those language immersion programs are in the community to share with families, right? And raise awareness to ensure equitable access. We really, when we think again about quality rating systems, all the examples I just gave about kids with disabilities not being included in lots of QRIS systems, language of instruction, access to bilingual staff, sharing information with families in their home language, family coordinators who speak to families, like those things are not included or not considered part of quality. And so again, you could be in a community like the one where I grew up, where we were almost all Mexican American, all bilingual, Spanish dominant, a mix of that, and you could be provided English only instruction and be rated a 5-star, right? Even though there is a big mismatch between the services you're providing and the kids who you're providing services to. So really thinking about how, when we think of quality, we're thinking of these pieces. Next slide. Okay, I think I covered some of these. And really thinking about the consumer education website and accessibility. Let's go to the next one. I want to leave plenty of time. All right, I'll pass it back to Dr. Boucher here.
Thank you. So we've got 3 more recommendations we want to share with you. Number 7 is really thinking about emotional well-being, specifically through the prevention of suspension and expulsion as part of the requirements under CCDF. We know from research and experience that emotional safety and well-being, social and emotional development is a defining feature of a positive, quality, responsive early learning environment. And we know it's associated with a wealth of benefits like children's psychological, physical, mental, academic well-being and success. But the use of harsh discipline, suspension, and expulsion undermines that emotional safety. And we also know from research that racial disparities continue to exist in the use of harsh discipline practices, including seclusion, expulsion, suspension, and harsh and exclusionary discipline. It disproportionately impacts also Black children, Black boys in particular, Indigenous children, and children who are in the child welfare system. So on the next slide, we have some recommendations specific to how do we think about promoting and ensuring emotional well-being across the CCDF plan, specifically focused on the prevention of suspension and expulsion. We encourage states, territories, and communities to really think about how policies on suspension and expulsion, which are required under the CCDF plan, how are those addressing emotional safety specifically, and how are they going to address the racial disparities that and other disparities that exist in the disproportionate application of discipline policies. Again, you'll see here we use the consumer website as a lever for information for families, as well as a place where data could be collected and disaggregated to be made publicly available for folks to make decisions. And so under this recommendation, we encourage that suspension and expulsion prevention policies are informed to parents on the consumer website, including specifically training, coaching, and other resources that providers that is available to providers to foster that emotional well-being type of environments. And thirdly, describing an option specifically in the section around reporting concerns to the state about CCDF providers, including a specific description of the availability or opportunity for families to report concerns with discipline or a violation of the state discipline, suspension, or expulsion policy to the lead agency. That's part of that hotline or similar reporting process that's available to parents to submit complaints. Next slide. And again, you'll see data as an important piece here, encouraging states and territories to collect and report data to the extent possible on the number of suspensions and expulsions across providers, again, through the consumer education website as a lever, which can help families, which can help the public understand how the suspension and expulsion policies are being implemented across communities, and then helping inform parent choice around the types of providers that are available. And next slide. Recommendation number 8 looks at the improvement of data systems, and specifically how we can publicly report data more meaningfully to be used in decision-making processes. We know that better data is critical to helping us understand what the inequities are in opportunity, especially knowing that there's well-documented research and some data around access and experiences specifically for children from marginalized communities. Overall, for example, we know that inadequate pay is consistent across the early childhood field, and it disproportionately impacts. There's an unfair racial and position pay gap within the childcare system itself. So one of the recommendations here is for states and territories to create a plan to track the pay gaps, especially the racially based pay gaps within the workforce, and use the data to improve the compensation of the childcare workforce under the provisions of the new CCDF rule. Next slide. And to collect and report disaggregated data to the extent possible for childcare supply and childcare provider participation across race, ethnicity, income, and other specific demographics and ability and disability to the extent practical without identifiable data. And again, to help make decisions to improve where states might prioritize specific activities with their quality spending and other activities for childcare. And then our final recommendation, number 9, is to, next slide, please, to align with the equity priorities. We think it's critically important for states and territories to go above and beyond the requirement just to have a public comment period. That's an important part and a requirement of the CCDF rule. And states should be going above and beyond to ensure that there are consistent, ongoing opportunities to actively seek guidance and provide strategic planning forums among parents of young children, especially parents receiving childcare subsidies, early childhood partners, childcare providers, tribal communities, and creating spaces where we can examine policy, data, and funding landscapes collaboratively. Which then leads us to our next recommendation under this overarching piece, which is to utilize the CEP's Early Childhood Equity Strategic Plan template, which is a thoughtful designed guide that helps states and territories and communities walk through their own landscape analysis to document some of the strengths that exist, as well as some shortfalls that they notice in existing policy, data systems, and funding, and to start to plan out what exactly they're going to do to address those inequities in the system. And you can access that report at cep.asu.edu. Chantel, back over to you.
Now we're gonna turn just to a conversation, and if you could drop your questions in the chat. We've gotten a couple really great questions that we'll work on typing out as we go, but I want to welcome in Dr. Rosemarie Allen to the conversation, and she's worn so many hats over the years, but really racial equity leader and former childcare administrator, right, are two of the ones that we're really going to be bringing together today. But welcome, it's so good to have you here. Oh, you're on mute.
It's so good to be here. Thank you for having me. And I'm wondering if we can stop sharing just so that we can see each other as we talk.
Yeah.
Yes, thank you. Thank you so much for having me. Excited to be here and super excited not only about the state plan and the overview of the CCDF plan, but also the report is just magnificent.
Let's jump into the first question. So as a former CCDF administrator and a leader in advancing racial equity, what advice do you have for lead agencies and state and community members as they work toward addressing access, quality, and equity in their state plans?
You know, Chantel, the advice I have is based on the mistakes I made. And the key here is to center children and families and those working directly with children. So many times we're charged with writing this plan and to getting input from stakeholders, but it's rare we really go to the beneficiaries of the plan, which are ultimately children and families. So my advice would be to center children and families so that we're not so prescriptive and assuming we know what families need, but to really create a plan that meets their needs from their perspective, as well as the needs of those working directly with families. I love, love, love how the workforce and children are centered in this new plan. I love that when I think about the things that stand out to me here, the whole idea of limiting how much families copay, how much they pay. But also when you look at our workforce and our owners of childcare facilities, for so many years, they have been paid based on attendance. And this new priority of basing on enrollment it's a game changer for families. When you think about, for providers, when you think about, I have this slot and my market pay families, the people who are paying the market rate, that they pay whether they come or not. So I know that that amount of money is going to be paid. However, when I'm dealing with families who are receiving subsidy, and some of our counties, because we're county controlled here, some of our counties only pay for 5 absences a month, and that child might be absent because of a chronic illness for 2 weeks, then now I'm in a hole. So I think that's a game changer. And just really getting that input from providers for what they need, as well as the presumptive eligibility. How much do we make families experiencing poverty jump through hoops to get documentation over and over and over again? And now it says that if you can presume they're eligible without requiring 2 weeks of a pay stub every 2 weeks in order to prove it. So those are the things that really stick out to me, and some of the advice that I would give to CCDF administrators.
Eric, were you going to jump in for the next question, or do you want me to go?
We're curious, what are some successes or challenges that you have faced as a state administrator with ensuring and addressing access to quality early care and education, maybe specifically for priority populations? Like, how did you define priority populations, and what were some of the successes and challenges in addressing that?
Challenges and successes. One is that I have to be very vulnerable here and say that as a state administrator, my main focus was on quality. High quality, high quality, high quality, which is very narrowly focused, defined. And what I've come to learn over the years is that high quality programs mean absolutely nothing if the children and families who stand to benefit the most have no access to it. And that's when I began to really focus on equity and what that means. So again, I'm going back to Chantel's question, what would my advice be, is to really dig through this report, look at those equity elements, because as in one of our other CEP reports, equity is quality and quality is equity. And when we have QRIS systems that can be 5-star rated and not address those issues we talked about in terms of language, suspensions, and access, then that's a problem. Then we need to go back and revisit that. And we are doing that now in Colorado. I'm very, very excited to have on this webinar today our inaugural director of DEIB for the state of Colorado, Nikki Adams, who's looking at equity indicators across the board. So some of the things that we did in terms of challenges and successes. One, we wanted to address the suspensions of young children and the disparate suspensions of Black and Brown children, especially Black children. So we put in to licensing rule that all facilities must have a suspension policy. And that's what we called it, a suspension policy. So while that was a success to get it into rule, the challenge now is that people started creating rules about how they were going to suspend children. So as you look through this report, we have to be very careful. And I love the wording here that says, how will we prevent the suspension of children? So that now we're not looking at what can I do to suspend them, but we're looking at all of the indicators, all of the elements and components that must be in place in order to prevent suspensions of children. Another thing we did in licensing rule that we're very, very proud of is that we eliminated some of that language that led to the exclusion of children with disabilities. Our rules no longer allow our facilities to say you have to be 2 years old and potty trained. We don't talk about the age at which you can potty train, so that those potty training techniques can be culturally aligned. And we also provide right now, which is really exciting and a great success, using some of our ARPA funds, we are providing free classes to early childhood providers. In our licensing regs, you need 2 classes, Introduction to Early Childhood and Social Emotional Strategies. in order to be left alone with children, to be able to supervise children. And the state they're paying for anyone who wants to take those classes. They can take them free. So it's addressing the shortage in the workplace. And for those people who can't take classes at night or who don't want to take them online because online doesn't work for them, we have implemented accelerated early childhood classes where 2 weekends now is equivalent to 1 class. So they can take those classes in a month. So really addressing the shortage, addressing those who have been most marginalized and not able to access professional development, and for them to be able to take those classes free. That's another huge success for us.
I think in a lot of places, when the CCDF plan process comes up, what ends up coming out the other end is often the status quo or continuation of a lot of stuff that had already been happening, and just kind of renew it, but it's the same kind of thing. I guess 2 questions. How do you break out of the status quo and start to really embed some of these meaningful policy changes and deep quality investments in equity? And then part 2 is, how do we ensure that it doesn't just sit on a shelf, and that it's really used as a strategic guidance document, as a progress tracker, as an accountability piece in states?
Thank you so much for that question, Chantel. And I think that the way we break out of the status quo is to stop doing the same things, stop going to the same people, stop going to the same stakeholders. That one of the things I learned as an administrator that still guides my work today is you have to be concerned about the people who are not at the table. So many times we focus on those who are there, but you need to look around your room and you need to see if there are people who are really, really doing the work for emergent language learners. We have to look around and see who's doing the work of addressing disproportionality and early childhood suspensions. Who's doing the work? And if they're not there, why aren't they there? Are our rural partners there? Are our families there? Are health providers there? Because as long as we keep doing and going, as long as we keep going to the same people, we're going to get the same results. So that's the first thing. New folks, I'm not saying that stakeholders who are currently involved are not valuable. They are, but we're still doing the same things. And look at the data. When we look at this report, we see that we're not making a lot of progress. So we have to change things up. Who are those unusual suspects? And then the second part of the question is, we have to have accountability teams. I know, again, Nikki Adams, who's here, she is creating an equity advisory board for people across all elements and categories of equity so that they can come together to inform what the state is doing. How amazing would it be if we now have this as a guiding force, and that state plan is reviewed every 3 months to see where we are, because there must be some accountability. Because right now you're required to create it, but what happens at the federal level? Oh, check mark, it's done. But if we are who we say we are, then we have to do what we say we will do. And we have to have people in place who's going to hold us accountable for doing just that. So I think that's the way we keep it off the shelves and to the hands of the people that matter. And not only that accountability team, I keep holding the report up, but not only the accountability team or the advisory team, but you know how people come up with these very expensive annual reports? They're great, they're nice, doesn't have to be all that. But however, I believe that we should have a report card on our state plan every 6 months on how we're doing. That's the way we're going to get it off the shelf.
Eric, I think we might have time for one more quick question before we close this out.
Yeah, we've got a question from the audience. Rosemary, is that okay if we ask you that question?
Absolutely. I don't.
So this is about grants and contracts. So the our report really identifies how important adequately funded grants and contracts are for that consistent, reliable funding to help resource providers with what they need to implement quality responsive services. But the final rule doesn't specify how many exactly that is as part of your structure. It's some grants are required, right? Some grants and contracts. So this person asks, what are some ways that we can push lead agencies to fully implement grants and contracts as a tool for equitable access, especially for special populations, rather than just being an act of compliance to meet the final rule? And if you have any programs or bright spots to share.
Well, I'll have to say that the Early Head Start Child Care Partnership is the gold standard. It's the gold star. Right now, we have a blueprint. We have a blueprint for grants and contracts. And we also have the data that proves it works. It's really, really hard for states to decline opportunities that work. So I would say, Chantel, does every state have an early child? Not every state. Well, look at the state.
Well, there are local grantees, but in terms of state grantees, I think it's 7, 8, something, less than 10, I think.
But I think you look at that, look at what works, and use that as a leverage point. And look at the data and use the report, because I know some things are optional, but you have to understand the power of one, whether it's one person, one organization, one legislator. Again, it is very hard to decline success. And that partnership has been very successful over years. And again, is the blueprint and the gold standard for grants and contracts. So I say use that.
I think it goes to the question and point I was making earlier, right? How do you bust out of the status quo of compliance? So we're not just seeking the check mark, we're seeking to make change in the community. And how do we use grants and contracts as a lever? Because again, they're just a lever, right? You have to build in the right funding formula and expectations into these grants and contracts. And that's where the Early Head Start Childcare partnerships can be super helpful in providing that template for what should go in a grant and a contract. What expectations can we bake into them, right? To really increase quality and stability in the system.
And I have to say, I forgot one bright spot, Eric, when you asked, that we're really proud of here in Colorado. We talk about our children who are emergent language learners and how they're not having access to instruction in their language. But while we see that happening, what needs to happen on the forefront in order for children to have teachers who speak their language, administrators who speak their language. And one of the things that Colorado has done and our legislature has funded is a bilingual licensing unit, so that now we can license programs for people in their language, primarily Spanish right now. The rules are in their language, the licensing monitors are in their language, so that people can now recruit people who speak the language, and children will have access to teachers who speak the language. So doing some of that foundational work is going to be critical in addressing some of these indicators.
Yeah, definitely moving upstream, right? Identifying where your inequities are in your system, and then being strategic about how we're investing the limited quality dollars that we have to really move the needle on some of these places. I think we're out of time. Thank you so much, Rosemary and Eric, for joining us, and to everyone who joined in. Again, you can check out the report on our website, along with all the other links and reports that we shared in the chat. And thanks so much for joining, and we look forward to staying in touch with you all. Have a great weekend. Bye-bye.